Uva-ursi, also known as bearberry or Arctostaphylos uva-ursi, is a plant whose leaves have been traditionally used in herbal medicine for various health benefits. Below are some of the commonly recognized benefits of uva-ursi leaf. 1. Urinary tract health. Uva-ursi is most well known for its use in supporting urinary tract health. Its active compound, arbutin, is believed to have antimicrobial and anti-inflammatory properties, which may help in the treatment of urinary tract infections, or UTIs. When arbutin is broken down in the body, it releases hydroquinone, which has antiseptic qualities and helps eliminate bacteria from the urinary system. 2. Diuretic effects. The leaf acts as a natural diuretic, meaning it helps increase urine flow, which can be helpful for flushing out toxins from the body. This property is often utilized to support kidney health and alleviate water retention. 3. Antimicrobial and antiseptic properties. Uva-ursi has been traditionally used as a natural antibiotic, particularly for its antibacterial effects against harmful pathogens in the urinary system. Its antimicrobial properties make it a popular choice for those looking to treat or prevent infections naturally. Anti-inflammatory properties. The plant contains tannins, which have astringent properties. These help reduce inflammation, especially in the bladder and urinary tract, thereby soothing irritation caused by infections or inflammation. Some studies suggest that uva-ursi may help in reducing the acidity of urine, which can contribute to a more favorable environment for the healing of the urinary tract and bladder. In addition to helping with UTIs, uva-ursi has been used to support overall bladder health and reduce symptoms of cystitis, which is inflammation of the bladder. The plant has been used traditionally to help with overactive bladder and promote comfort during urination. Uva-ursi leaves contain certain antioxidants, such as hydroquinone and tannins, that may support skin health when used topically. Historically, it has been applied to the skin to treat wounds, burns, and other skin irritations, although its use for skin health is less common compared to its role in urinary tract support. Considerations. Uva-ursi should be used with care, especially when taken for extended periods, as excessive intake of its active compounds can cause side effects. Prolonged use or high doses may lead to nausea, vomiting, liver damage, or other gastrointestinal disturbances. Pregnant or breastfeeding women and individuals with liver conditions should avoid using uva-ursi without consulting a healthcare provider. It's essential to talk to a healthcare provider before using uva-ursi, especially if you're treating an infection, as it's not a substitute for antibiotics when needed.